In the heart of Metro Manila, a single phrase captures a harsh reality. When it rains, it floods. Hello, we are from the MAED Science Program. Today, we are presenting our case study which focus on a growing health threat in a flood-prone cities like Metro Manila. I am Joyce Martinez and together with my research partner, Maria Carmel E. Macasinag, we examine an outbreak of leptospirosis following flooding in Metro Manila, a public health response. Flooding in urban areas like Metro Manila poses a serious public health risk. One alarming consequence is a rise in leptospirosis, a deadly but preventable disease. It is a bacterial disease that spikes during the rainy season, especially when people are exposed to floodwaters contaminated by rat urine. Sadly, what many see as harmless flood exposure can lead to serious illness or even death. Our study investigates the causes, challenges, and responses to a recent outbreak and explores how we can better respond to this ongoing threat. The Philippines experiences torrential rains every year. In densely populated and poorly drained areas like Metro Manila, flash floods can occur within minutes. People often walk barefoot through dirty water, unknowingly exposing themselves to leptospira bacteria. Leptospirosis can be mistaken for flu, dengue, or typhoid because symptoms like fever, muscle pain, and jaundice overlap. Diagnosis is also often delayed. This leads to complications such as kidney failure and even death. In 2024 alone, the Department of Health reported 2,734 cases in National Capital Region. This is a 90% increase from the previous year. Most cases were in Quezon City, while Malabon had the highest attack rate. Several cities had also reached epidemic levels. Our study aims to understand the outbreak's root causes and examine the effectiveness of public health responses. Let's take a look at this graph showing yearly leptospirosis cases from 2018 to 2023. From 2018 to 2020, there was a gradual decline, but in 2021, cases began to rise again. By 2022, they had doubled and a consistent upward trend followed in 2023. The Department of Health noted a 16% increase in just the third quarter of 2024. This sharp rise suggests that while some control measures were implemented, they were not enough to offset worsening environmental and medical conditions. The graph clearly signals a re-emerging health crisis. And it's not just a seasonal spike, it's a trend. If this pattern continues unchecked, the health system could become overwhelmed. For our methodology, our study used qualitative analysis of news reports, health bulletins, and case data. We reviewed documents from DOH, interviews with health officials, and scientific articles. From there, we analyzed three critical areas, such as medical responses, environmental factors, and community behavior. Medical responses includes diagnosis, access to tests, and treatment timelines, while environmental factors includes floodwater contamination, drainage, and sanitation, And lastly, community behavior involves awareness, self-medication, and exposure habits to leptospirosis. This holistic view helps us pinpoint the gaps in both prevention and intervention. Based from our findings, we found that most cases became severe due to delayed or incorrect diagnosis. Symptoms often go unnoticed or patients self-medicate. Meanwhile, diagnostic tools like PCR or antibody tests are not always available or affordable, especially in local clinics. We also found that public response is hindered by low health literacy. People underestimate the danger of wading in floods or ignoring symptoms until it's too late. Environmentally, while cities are improving drainage and enforcing anti-flood regulations, waste management and discipline remain weak. Informal settlers often dispose of garbage improperly, clogging drains and creating bacterial breeding grounds. In terms of innovation, Filipino scientists like Dr. Nina Gloriani are working on a locally developed vaccine because imported vaccines don't work well on Philippine strains. But sadly, research is slowed by lack of funding. To address this complex crisis, we recommend the following. Strengthen early detection systems at local clinics. Fund and fast-track local vaccine development. Integrate leptospirosis education in school curricula. Improve coordination between LGUs for consistent sanitation and flood control. Enforce laws like MMDA Regulation Number 24003, banning unnecessary wading in flood waters. Most importantly, we must build a culture of health literacy, where prevention, not reaction, is the norm. In conclusion, leptospirosis is a silent killer in flood-prone urban areas. Our case study shows that a united approach in spanning health, environment, and education is critical. But with the right tools, policies, and awareness, we can protect lives and prevent future outbreaks. Let's stop walking blindly into flood waters. Let's walk informed, prepared, and united.